Welcome to this short video from Myopia Focus on the current public awareness of myopia management in the UK. My name is Jason Higginbotham and I am an optometrist and managing editor of myopiafocus.org. So what does the UK public know about myopia and its associated risks to long-term visual health? We conducted a survey of parents in 2023 and again in early 2024. Participants had to be responsible for the eye care of a child under 16 years old, or they had to be myopic themselves. It's important to remember that this was perhaps not the most wide-scale survey. There were 200 respondents in the 2023 survey and in the 2024 survey. 46 in 23 had a myopic child and 81 in 2024 had a myopic child. We used a platform known as Prolific to conduct the surveys, and we split the questions for those whose children had been diagnosed with myopia and those who hadn't. We also conducted several more questions on the second survey than on the first. One of the initial areas that we looked at in the survey was awareness of the terminology. We asked respondents that before starting the survey, had they heard of the term myopia, and we told them that this was the scientific term for short-sightedness. Whilst almost everyone had heard of short-sightedness, the term myopia was much less well known. However, surprisingly, 28% of parents with myopic children hadn't heard the term, compared to 39.5% without myopic children. There did not appear to be any significant change year on year. We also asked respondents if they'd heard of the term myopia management and also where they'd heard it from. It's not surprising that only 11% said they'd heard of myopia management, but those that had primarily heard from their optometrists, which of course is encouraging, with an increase from 2023 to 2024. Anecdotally, when I was in Germany recently, I noticed there were adverts and billboards in trade stations, shopping malls, etc. And I was amazed at how much more the practices publicised myopia management and how much more public awareness of the condition in the therapies there appeared to be. This does show that there can be impact from campaigns, from direct practice interventions and efforts. And it would be good for a larger scale academic study on this across the UK and perhaps Europe or even further afield. It does appear that optometrists are one of the primary sources of public information and awareness on myopia management. We then asked about the awareness of the term axial myopia. Year on year, there is no change in awareness of the term, but the awareness was very, very low indeed, and this is a shame. I believe we need to change our approach to how we educate both parents and perhaps clinicians on myopia, with particular reference to axial myopia. Certainly for me, perhaps the therapy should be called axial length management. I think this is more realistic and representative of what it is that clinicians are actually trying to do when administering the therapies. I'm sure some will disagree, but whatever the therapy is trying to achieve directly, the indirect aim is to control how much the eyeball grows. We also asked respondents if they'd seen any information on myopia in the press or news. The majority had not. Hardly any had even heard of the announcement from Apple about the screen distance tool added to the iPhone. We asked parents if myopia posed any increased risk of eye diseases. Those without myopic children were less concerned or aware, perhaps, whereas there did seem to be an increase in concern amongst parents with myopic children. And there certainly seemed to be an increase year on year as well. Next, we showed those doing the survey the below table, and we asked them if their attitude towards myopia management had changed. And this is modified from the Global Myopia Symposium 2020 and other publications, but we're all quite familiar with these risk charts. And it's very clear, unsurprisingly, that parents were, in general, more concerned about their child's myopia after the survey. We don't want to scaremonger, but I believe that sometimes we must be truthful in ways that have impact and change attitudes towards something that is generally very important. We then asked parents had they received any advice or recommendations from your child's eye care provider on how to manage myopia in your child, and encouragingly, it's clear that more eye care practitioners are discussing myopia management with parents, a fairly good increase from 2023 to 2024. And whilst numbers are small, more children with myopia are being managed, mainly with glasses. This increase in those engaging in therapy may again simply be a reflection of a higher proportion of myopic children and parents in the survey. However, hopefully, it represents the result of increased efforts to engage in myopia management by practitioners and perhaps a small increase in parental awareness from other sources. I find this chart quite useful in understanding the relative efficacy of different myopia control interventions. And some of this data does seem to be reflected in other studies and a fairly recent Cochrane review as well. It's a little concerning that at present there is no access to properly formulated low-dose atropine in the UK, and there is still some conjecture over the correct dosage, and one or two studies have cast doubt on the effectiveness of very low-dose atropine when compared against placebo. Far more encouraging is the effectiveness of orthokeratology. However, there appears to be some reticence from practitioners in prescribing or using ortho-K, particularly in children, and there is some trepidation from parents as well. Education, once again, appears to be key. And why is this important? Well, basically, earlier intervention, of course, will be far more effective and will produce longer-term benefits for the patients. And we are in the business of eye care, so why avoid this huge potential market and a lot of loyal and happy new patients? And consider the legal implications of not doing enough, not making proper notes and having disclaimers if you don't want to engage in myopia management or axial length management as we might call it. And consider the economic impact of sight impairment for countries in the future. It's huge. However, also consider the impact economically, cosmetically and practically for high myopes, and we can help to lower this impact. So what barriers exist? First and foremost, before even considering the price, there does appear to be a huge lack of public awareness and education around axial myopia and its associated risks. Secondly, and very importantly, price does appear to be a significant barrier. This may be reduced if a larger number of people engage in myopia management. And this may also be more affordable if low-dose atropine becomes widely available, especially on GP prescription perhaps, for example, to be used as an adjunct to other key therapies like ortho-K, for example. The perceived cost of diagnostic equipment, such as biometry, for example, as well as a lack of direct access to comparative data for planning therapies and showing results to parents, amongst optometrists also appears to be a problem. So is the potential lack of awareness therefore a demand or a barrier? I think it is a barrier, but that barrier is a bit of a red herring. As eye care practitioners, we have a duty of care, and the College of Optometrists have now made this clear. It starts with eye care practitioners. We asked respondents if their child was diagnosed as myopic, how much they'd be prepared to pay per month for them to have a suitable myopia management treatment. And between 23 and 24, it appears that more people would be prepared to spend more on myopia management, particularly between roughly £20 to £40. Now, this may be just due to an understanding of inflation, of course, but perhaps it also reflects a greater understanding of and willingness to engage in myopia management. But it's relative. We set a scenario that if their child was found to be myopic and at a higher risk of developing myopia, and that the respondents were told that the price monthly to actually engage in myopia treatment was £50 to £60, how likely would they be to proceed? And as you can see, there's not a big difference between 2023 and 24. And ultimately, there's a fair spread of those that would and wouldn't engage. The high risk of myopia seems to be of some concern, but ultimately, I believe if an eye care practitioner was describing this to a parent rather than on a survey, it's likely that more would be willing to proceed. There is some evidence to show that the cost is perhaps of lower importance to parents than we maybe think, and in many cases the long-term risks to their children's health and the advice of optometrists are far more important in whether or not they'll make a decision to adopt myopia management. There are many organisations which provide resources that you can download and use for your website and in practice promotional material. However, this is putting the onus on practitioners to educate their patients, and their parents maybe, and this perhaps misses the point. We need school education campaigns, public health campaigns, and we must try and increase press coverage of the condition. Therapy suppliers and those who make the diagnostic devices perhaps need to do more to invest in regional, national and international press and media campaigns with real impact. But also, who is lobbying Parliament? We have a link on our website to a petition which includes, amongst other things, a desire to lobby Parliament on changing the way children's eye care is funded in the UK. We also want to change the government's stance towards educating the public about myopia and to accept that this is a significant ocular condition that warrants government investment. And it would be really good if those watching this video could actually go to the website and the petition and sign it and perhaps share it with their patients and other people to try and get real momentum and impetus behind the campaign. We know that myopia education is a global challenge. One study from China concluded that school-based myopia prevention health education improved knowledge, attitudes and skills regarding the condition. And this appears to have also been reflected in a study in Singapore and to an extent in Ghana. The Ghanaian study also showed socio-economic factors affected the education and subsequent knowledge, but also that there was a largely negative attitude towards myopia. Another Chinese study concluded that the awareness level among patients with myopia regarding high and pathological myopia is currently insufficient. Therefore, it is important to enhance education efforts to reduce the incidence of adverse outcomes. And of course, this is in China, where their efforts are much greater than probably any other country to educate and inform patients and parents. And of course, they have a much higher prevalence of myopia. So the educational challenge in the UK is perhaps not as great, but is still very valid. The Vision Council reports several highlights. 2 in 5 parents report knowing exactly what myopia is, and an additional 1 in 3 reports having a general sense of the term. Out of the large survey of 2,209 parents with children aged 5 to 16, only 1 in 8 parents saw a lack of outdoor time as a risk factor for myopia onset. Over half of parents believe excessive screen time and genetics increase the risk of myopia in children, which of course is very true. Most parents believe that poor academic performance and the need for stronger prescriptions are complications associated with myopia, but fewer understand the risk of eye diseases or vision loss. Another interesting recent study compared relative popularity of various terms for myopia between 2004 to 2023. And you can see that the understanding or the popularity of, of the term myopia worldwide waned and is now increasing fairly notably, as you can see, which is a good sign that ultimately awareness levels are increasing. It's clear that most parents believe that the NHS should fund myopia management, but a surprising number don't believe so or are unsure. The number has also dropped, certainly between 2023 and 24, perhaps in recognition of the fact that, of course, the NHS is under stress, particularly post-COVID. Interestingly, the numbers for parents with myopic children and those without are more or less the same. In conclusion, parents really will take your advice and, in most cases, will invest in their children's current and future eye health. There is still much to be done by practices, suppliers, manufacturers and optical professional bodies, along with government, to increase public awareness of myopia and its management significantly. The provision of children's eye care in the UK and GOS in general is poor. More money and effort needs to be funneled into improving this, particularly with reference to myopia. We have a duty of care to do more to inform our patients of the risks of progressive axial myopia. We can also increase practice revenue substantially too. It is not unprofessional to be profitable. In fact, we owe that to our patients.